This meeting is being recorded.
All right, hello. Hi, everybody. I see a lot of new faces. This is awesome. I'm so glad that you all come on to join us.
All right. Am
All
I
right,
on?
you want to kick it off? Yeah, go ahead.
All right. So, hi, everybody. Welcome to our right now bi-weekly meeting for the people or for all the people. We're really excited that you guys could join us. Just a couple of housekeeping things. So the Zoom meeting is being recorded so that anyone who isn't able to attend can watch it later. We'll post it to the YouTube video. So by being on this, then you're consenting to that being recorded. So, and also by participating, everyone is muted upon entering the room just to minimize any background noise. We will at the end have a question or Q&A session. If you have any questions throughout the call, if you just put them in the chat and we will address those. And then as always, just be respectful and courteous to everyone. So if you want to say something, if you can raise your hand, and we will get to you as fast as possible. But we're going to have a great call. We've got a lot to talk about.
Okay, and we always want to start out our meetings letting anyone who's new here know who we are, why we're here, and what we're up to. So, Amanda, can you share our mission statement and
would be happy to. So our mission statement is to unite families from every county in Florida, fostering personal connections with local legislators through the sharing of our stories, our personal stories. So by doing that, we aim to bring about positive change during the legislative session.
And we are family-led and family-driven. We have providers that are allies with us, and friends. Anybody is welcome to come to our meetings. We just want anybody that's new here to know that we are a group of families that are the lobbyists for our individuals with developmental disabilities, and we have really come together kind of almost by accident. It was just a miracle of the things we were able to do in our first year. And one thing I want to do before we go into our next segment here is let everyone know that today celebrates 1 year of our group meeting on the Zoom call, which is crazy. We did a tremendous amount of work last session. We continue we want to grow on that. And by coming on these meetings, we're going to cover a myriad of ways that we can get involved and how to maximize our efforts in making positive change. So, got a little bit more organized here as we've learned this process along the way, and we've come up with a template agenda for everyone to be able to participate in our meetings, and I'll go ahead and send that to you all so you can get an idea of what the meeting flow will be like every other meeting, and give you an opportunity that if you want to present on a topic or something going on in the world of advocacy, that we can all meaningfully participate on the meetings. So our next topic is going to be titled, a working title, Advocacy Education Topic Moment. Tom Nurse is going to share a topic that is something that he's looking to work on this year in legislation, and just give some education on it. Tom Nurse.
And I have started my 5-minute clock. Hello, everybody. Welcome. And I'm Shelby's dad, and I've been involved with advocacy since pretty much her birth. Partners policymaking graduate as well, and spent some years as a statewide parent consultant to early intervention, where the focus was on families, on family-centered practices. And I think that still remains the cornerstone of our advocacy, is that the stability and engagement and supports to families makes a tremendous amount of difference on the outcomes of what people we love with developmental disabilities. So that if we can focus on how these supports and services either do help or can help or could help in our storytelling, it can help bring it back to the family. Because regardless of your political perspectives, we all have a strong belief in the importance and value of families. We all can support and recognize the profound impacts that developmental disabilities have had on the entire family. And we can also be really strong advocates on what can we do differently? What can we do to improve it? So part of what I get to be as the OG, which is, I guess, a nice positive title of somebody who's been around a long time, is that there's a reason why we have the med waiver. There's a reason why APD exists. And the primary reason why it exists is because of families, because of advocacy, because if we can go back to remembering Katie Beckett and her parents who fought like hell to get her to be able to come home from the hospital and stay at home, and they opened up the doors with the Katie Beckett waiver, which was the first home and community-based waiver. And then we remember the impacts on people that are poor that were receiving Medicaid-funded state mental health services, and the Olmstead decision that opened the doors to the home and community-based services. And that opened up the opportunity for Florida to settle the class action lawsuit that was against them, in Florida being held in contempt of court by bringing the home and community-based waiver. And so our focus today is on how does that impact families? And what do we mean by family-centered practices? So in the home and community-based services, the primary philosophy was, we can do this. We just need some help. We don't need our daughter to be institutionalized to provide the care she needs. We just need some of those help to come into our home. And so if we look at where some of the opportunities for this legislative year comes from, where I want to focus a lot of our efforts on is how does the lessons learned in early intervention, where we have identified folks early with developmental disabilities and began to hopefully connect the dots in that transition to pre-K and public schools, and how SSI and Medicaid and all these things combine. Well, one of the biggest challenges has been, since the inception of the waiver here, the goal had been to create a continuity of care. That the Early Steps program would hand off to APD and to Medicaid, and there would be a continuity of care and a consistency of funding. Where we're laying right now is the average onboarding age on APD is 23 years old, which means from that birth to 3-year-old, there's a huge drop off in some of those continuity of supports and care. We spent a lot of focus on this group talking about the revenue estimating conferences and getting in part of that in that. And so if you are served from 3 on to 18, you are actually till you're 21, you're covered under the Medicaid state plan and protected by the federal laws of early periodic screening, diagnostics, and treatment. That has been challenged by managed care. So where our focus is because this starts to get very wonky sounding, is that what can we do to help bring the stories of families that have both experienced that continuity and those that have not, and how can we address improving the outcomes for people that are intended to be helped, individuals with developmental disabilities. So what I hope we can focus on this year in part is how do we catch those young kids, keep them being appropriately served and supported by schools, by the developmental disabilities medical community, and by recognizing the impact on families, and finally looking at how consumer-directed care continues to recognize, particularly those with medically, behaviorally, and developmentally severe disabilities. Many times, families are the only consistent there, but they're devastated by the economics of not being able to keep a job while doing the hardest job possible, which is caring for someone with such significant needs. So the focus is on how do our stories, how do we show systems that are capable of doing this and help them be activated to do that. And so that's a little bit of the history that shows it's us, our family stories, our family focus, our drive towards the loved ones we support, and valuing the impacts that commitments that we have, and teaching our legislators about the opportunities. Much have already been built. It's just needs some help being implemented. That's my 5.
Way to go, T Nurse, getting that right in time. And I want to say it again, just so if anybody's interested, if you have a topic that you are really invested in and want a greater amount of other families to engage with their legislators, you want to share some education. Um, we're going to have a sign up sheet. I'm going to get to that after the meeting, and we'll send out that in our Facebook group. And if you haven't given us your email, please put it in the chat, and we'll send you out an email. Um, we want to give you the opportunity to present on a topic. Each meeting, we meet every other week. And I threw the agenda that I put together today before the meeting in the chat. So coming up next is me. Okay. So we want to be able to report about when we meet with our local legislators. You know, some of those experiences are positive, some of them are neutral, some of them are not so positive, and sharing that with families is, I think, really helpful because when I first met with legislators, I had like all sorts of different ideas of what it would be like, and when people told me about their meetings, it gave a sense of comfort, and then also like uh, just an awareness that this is the purpose of our group. We're action oriented, and meeting with our local legislators is the key. That we want to share our stories and our truths with them to connect the issues. But the action piece of this group that is going to make this successful is each of us going out into our areas and meeting with our local guys and getting and connecting. So Elaine Turner is regularly on our meeting, and she wanted to be here to present, but she had a doctor's appointment she had to get to. So she asked if I could give a little update. Elaine has been advocating for her son, Ari, for 30 hard, like intense years. She's involved in so many areas in her local advisory councils, but she had never actually made an appointment with her legislator until yesterday. So she's in Brevard County, and she met with Representative Gottlieb, and her son Ari is experiencing dental issues and inability to get into a dentist, and has had bunch of issues related to that, and that is a very common topic right now with families. She was able to explain what was going on with Ari to Representative Gottlieb and his aide, and the biggest takeaway she wanted to share is that they were extremely receptive. They gave the aide and the representative gave her their personal cell phone and said, anytime you have an issue with Ari, please contact us. Please keep us informed on any updates regarding this dental issue. We're going to, do some work on our end to see how we can help. And that's like that's the ticket, right? Like, she's able now to have open communication with her legislators when things come up personally and systemically. They have now a relationship, and she was just through the moon. Like, I wish that I'm not going to convey it the way she did. It was an unbelievably empowering feeling, is what she described, to be able to take the problem into a solution and start working through it. So that's, I wish it was Elaine. Next week or next meeting, we'll have her come on and do a better version of her recap, because I wasn't there, but I could feel it, and that's exactly how I felt. It's how a lot of us have felt when we were able to make that decision to just go have the meeting. Oh, and her meeting was 15 minutes, so these are quick. And real quick before we move on to the next topic, I wanna make sure that last year we started this meeting right around time, and we were able to get into some appointments before all the delegation meetings came in. This year, I would really, really like to encourage families. This is the time. We are like really in the power window of being able to make those appointments, for them to be meaningful, that they can turn into bills. So if you have any questions regarding making the appointment, um, we'll walk through that, and you can put any questions in the chat, because that is really what we're about. We want to make sure that families feel comfortable to explain their story and have a successful meeting. So coming up next, I've asked Nicole to wait. Is that next? No, I've asked Melissa to explain something pretty exciting that they were able to do a couple weeks ago with Representative James Buchanan out of Sarasota. So, Melissa, are you on the call?
Yeah, I
Oh,
am.
there
I'm
you
here. Hi.
are. Hey.
It's nice to see you guys. So on the 26th in Venice, which is Sarasota County, Representative James Buchanan had come to the Loveland Center and met with a number of families that gathered there. And the Loveland had said that it was around like 150 people, and it was a good turnout. And it was an opportunity for Representative Buchanan's constituents with developmental disabilities and their families, if they have family, to be able to have just a conversation about needs. And he was there for over a couple of hours, and it was productive, and he moved around the room and he listened to everybody, and it was good. And I think that if we're able to kind of duplicate that in other areas around the state, with other representatives that have the heart to help, that they're the ones who want to try to see things better. That's something that I think that if we can concentrate on doing that, I think that we will be able to really have a much stronger voice in Tallahassee. And those individual appointments and conversations with those representatives and their constituents in their counties, in their districts, where you live, the people that you elect to get into those local offices, if you're able to help educate them on your needs, then they're able to have those conversations with other representatives when they're in session in Tallahassee. And when they do that, when they have those conversations with each other, and one of the things that he had said that was really necessary was and I'm really glad that he brought it up, was something called the buy-in. Getting other representatives, other senators, other people from other counties to buy in. So if they have those conversations in their areas where they've been elected locally, and for Buchanan, it's Sarasota County, and it's not all of Sarasota County. Our senator here for Sarasota County is Joe Gruder, so he's next on our list to get him to buy into what his constituents with developmental disabilities and their families in their area that they represent need. And that could be a range of things: housing, jobs, better access with, Medicaid, and just certain things to make things easier that are kind of common sense. There's no need to have so much incredible level of bureaucracy with a small constituency that is generally but very quiet, very, like overlooked, easily overlooked. And these guys don't, and I've had a couple of family members that had said to me, why don't they just know? How don't they just know? Because they don't know, because they don't have anybody in their home that they are providing care to that has a developmental disability, and they are not in the field like I am. That's the difference. They don't have it. So they don't just automatically know it. Just like we don't automatically know how to do, particular things and interact with particular people. It's just not our day-to-day experience. So we have to help them understand it. But having a group of people come to an area and one person come there was so much easier than I had families that, I had asked to, go and visit their local representatives, and I know they want to, and there's this safety in numbers thing that happens, and they don't want to go and have these individual, like 20-minute conversations with somebody they've never met about their person, and they sometimes feel bad enough anyway to begin with to ask for help in the first place, that they need to have assistance at home, and they don't want to just like show up there one-on-one. When there was that group together and we have a representative, and I didn't come up with that term, I have the heart to help. I don't have that experience, but I have the heart to help. That was something that Ben Albritton said during the Charlotte County delegation. And I was like, you know what? I said, that's good. I said, I think that there's a lot of them out there that feel that way. They have the heart to help, but they don't have that more intimate, experience. And they want to represent, they want to help their constituency, but they're not going to go and seek these folks out when they have other people coming to them that are grabbing their attention. So something like this, it was good. It was, he had that good conversations. Now, maybe during something else, he brought up delegations in the area. Now they've already kind of, had a little bit of an interaction with him. Maybe these guys are going to feel comfortable with going to the Sarasota delegation, when he's going to be there. And then he sees his constituency. And maybe in between, there's going to be some of those people who are going to feel comfortable going to his office in the district and forming that relationship. So then it just becomes more, like where he is getting an understanding. And then when people like myself and Alan are in, Tallahassee, and we're meeting with them, and they have that connection as well. So we're able to continue that advocacy with the imaginary everybody standing behind us, with that we're together. So they have a better idea. And that's how we, I don't know, hopefully make things better and easier and less stressful. And, we can just, I don't know, it'd be nice if we just could make things a lot easier and better. And I think that.
Do you think that they also want to hear solutions or suggestions or ideas?
Yeah.
Not just the issue?
Yeah, but you know what? Sometimes and I think that they already have, that they are hearing the idea. So one of the things is, quality provider care. Another thing is to alleviate the stress of what's been going on with Medicaid. There's been a lot of people that have been caught up in that. So in those aspects, those are things that they can help with, putting policy in place or unraveling some of the stuff that's just unnecessary. So yes, absolutely. But they are being told solutions and stuff. They are. So, but yes, but they have to, see the people as well. So.
Yeah, and I love how like that is a creative workaround. Not everybody does want to go meet with a politician by themselves and, explain their very vulnerable stories most of the time.
Right.
And it's comforting. You guys had like 150 like there was a lot of people at this meeting, right?
Yeah, and it was yes, it was a good amount of people, and it was everybody that lives in that area, and it was there was a couple of people that came in from not in right in his, constituency district area. But, I had a conversation with his aide at a family cafe. That was kind of how it had come about. I said, I would really like for him to, be able to have those conversations and stuff. And then I was like, it'd be kind of cool if he was able to come to them. And he was like, yeah, I think we can make that happen. And it was just, then it happened. But it has to, just him. We got to get the other folks to buy in. And by doing what happened there, having that conversation, educating.
Yeah, I think that's like a really easy ask too. Like you just went to the aide and said, "Hey, what if we did it this way?"
Yeah.
And it seemed like it worked well for him. And when you guys did that,
It was like it was a private delegation in a way.
yeah,
It was a private delegation. So there was no other subject matter that was going in there about, the transportation here and the college that's here and stuff. It was all just about, our guys and stuff. So, but I think honestly that there can be a few improvements made upon how it, rolled out. So, but all in all, it was good, but it needs to be duplicated is the thing. So I think it is an easy ask. I think that once it gets, starts to, get out there, it's like, okay, let's work on, Collier County and let's be strategic about it. There are key people that are in these particular, positions legislatively who already have a little bit more experience and they have more, kind of power, if you will, and more clout. They've just been around longer. And in Collier County, we have Pasadoma and, Stephanie, you're heavy down in Collier. So I think that she would be great, I don't think that she would not do that. And then we have, Albritton, who has said he's got the heart to help and he's very interested in rural services. And so am I. My first foray into this was DeSoto County for about 7 years after coming from New York. I like, rural is an interest. And he's the one that said that he's got the heart to help. So let's help him understand. So I think that they would be interested in doing that. What's a couple hours of their time to carve out for, that kind of a group of folks that he could then like come to and maybe really truly be able to be instrumental in helping that constituency. So I don't think it's and it's people in their neighborhood, people in their area. That's why these guys get into public service. They get in there to help make things better in that area. That's it.
thanks, Melissa.
Yeah.
Melissa, can you put your email in the chat? And then, like, if any
Okay.
of the families think that that'd be a good idea for your area, Melissa's humble, but very, very good at organizing and being able to make it simple for you so it's successful. I'm volunteering you for that, but I think that would be really, really great if you want to take leadership in your county. That would boost us. Private delegation meetings officially, I think Alan said in the chat. I think that's awesome.
The biggest thing I think to keep in mind is having that space. And that's something like I'm not gonna, like that's where like in these counties, just having a space that would be able to hold that. The Loveland Center in Venice was a great space for us and for our folks in this county. So that kind of a thing, just keeping that in mind. And then once it needs to get out with the families in those particular areas, in those particular counties. And and I will do absolutely everything I can with our contacts that are in that area, but it also needs to come from the people that are in those various counties around the state. So
Awesome. That's thank you so much, Melissa. I think that
yeah.
that is definitely a replicable uh a replicable part that we should start building out. I did reach out to Senator Pasadoma and Representative Mello to do something similar, and we're working on dates. And as soon as I get that squared away, if you're close by, come on over. Next, we wanted to talk about upcoming legislative specific events. And Nicole is out of Brevard, and I'm gonna let her share what she's doing in her area.
Well, hi, everybody. Thank you, Stephanie. Thanks, everyone. So in Brevard County, we're holding the Candidate Forum event. It's going to be specifically about disability. And so kind of like what Melissa did with Sarasota, this entire day is going to be from 9 to 3. And it's going to be just a focus on our issues. I have confirmations from almost every race at this moment. From the state Senate race in Brevard County, districts 30, 31, 32, 33, 34 for state rep, county commissioners, school board, U.S. representative race for District 8, and then a few judges and other local candidates as well, as far as like mayoral and city councilmen that are going to be in attendance as well. I have an invitation out to the governor's office. It has not been officially approved, but for the governor and Mrs. DeSantis, because of the Hope Navigators program, I'm hoping they might be able to make an appearance to talk for a few minutes at the beginning of the event. Also coordinated with a local base, Patrick Space Force Base, because our community encompasses what they call EFMP, which is Exceptional Family Member Program. So we also have coordination with the base as well, and a couple of the like the VFW and local veteran organizations also. A lot of it from what we've been trying to set up is kind of a collaboration, not just with our families, but with the nonprofits that serve our community, the organizations that work with us, trying to make it. I think if we all have the same idea, was the collaboration piece. A lot of legislators are not always familiar, as it's been said many times, with the needs of our community, because there are so many things they need to be read in on, so many things they have to learn when they get elected, and it can be overwhelming. So for having those kind of trusted partnerships with people like us that can tell them, this is what we're experiencing, this is what we need help with. So it kind of serves a dual purpose. First, they get a chance to talk to our community, and we get a chance to talk to them. And hopefully that relationship gets leveraged as we roll into delegation meetings, prepping for our next session, and so on and so forth. So yeah, our event's on the 20th of September after the primaries, which are going to be what is that? 10 days, 11 days we're away from the primaries. So, well, a lot of exciting times right now. We were trying to capitalize on the fact that this is an election year. It's a presidential election year, so there's a lot of news and media coverage. And so trying to get that focus not just on national news, but also, more importantly, where it affects us more is in, the local legislation. So that's our program. That's what we're getting ready to do. So if anybody has questions or anything, they can reach out. And it's a free event. And if you're interested, just let me know.
Can you put the location and time, like get the information for people who are in the meeting? This is that's genius, Nicole. Like, I go around and try to get the Parks and Rec department, the commissioner, and the city, and the school board, and the state, all to talk to me individually. This is think smart mentality. And one of the qualms I have with government in general is that all these parts that are linked together don't communicate. And what a cool way to just bring the conversation all together. And that's next level. So if we could get to Brevard on September 20th, that would be even that would just be huge. So all right.
I just ask if anybody is interested that they do RSVP, because we have limited space. So, because we're having it at the Space Coast Health Foundation. It's not a large building. We can probably accommodate around 270 people max. So it's a free event, so there's no cost associated with it. But if you are interested, just make sure that you use the link I put in the chat to register, because we have limited space.
Thanks, Nicole. And up next, Nicole. We really think that we've missed an opportunity this past year to talk about upcoming events and news stories that we can incorporate into our, advocacy awareness. And so Nicole has very graciously come up with some upcoming events that you guys can get involved with. Go ahead, Nicole.
All right. I'm going to share my screen and apologize in advance for all the stuff that I have open on my desktop. So just in advance so you guys are aware. But I'll show you, it's just a Word document that I've been trying to start to collaborate on that has a list of candidate events, conferences that are upcoming, as well as any other important dates. So this is something that I can even share if people want to submit, and I can add it all to this. And then I can just, as it's updated, share it in the Facebook group. But, so for example, a couple of different things. Advocacy Days. I don't know if Alan's still here. So, hey, for the Arc of Florida, in Disney in September. So a lot of these things that are upcoming. And then all of this I've been trying to kind of keep collaboratively from, anybody who sends me the information, I'll input it here. So that's one thing. Also, there's been a lot of meetings lately. I just had one today that was done by the Florida Policy Institute about the state of Florida and what did they call it? Children. Let me see if I can find you exactly what the Zoom information was called, but it was about the state of Florida and how we're not taking care of our kids, essentially. And FPI, Florida Policy Institute, was talking about all the different initiatives and things that were going on with regards to that. It was already discussed about the recent Medicaid unwinding. The state of Florida had, for example, a suit that was brought up against the federal government. It was dismissed in Tampa, but it was specifically to, and I can put the link for the article on that in the Zoom chat. But so events like this that are discussed that touch, maybe they're not specifically about IDD, but they definitely touch our families. Kind of keeping an overview of a lot of those types of meetings and events, exactly, Paul, or adults with development, because we all know it doesn't stop with when they turn 18 or when they turn 21, 22. It's all. So, that's the kind of information I figured what we could try to structure into these meetings going forward. So everyone has situational awareness, of what is currently being looked at, what's being discussed, and what's coming up, if that makes sense.
It does. And you know what? I think it would be a great idea, Nicole. Could you put your email down in the chat for if you guys
sure.
know of events coming up, ways to get connected, news stories that come out that you would like families to read about and share? Send them to Nicole so that we can have a hub. One of the things that I was really bummed about was the ADA, the 34th anniversary of the ADA. There was incredible opportunities for all of these meetings, and it was hard to keep track of where to go next. Florida Voices of Health did a really great webinar yesterday on dental services and dental programs. I know that September 3rd through the 5th, there is a DCF Children and Family Summit in Orlando that some of our families are coming out to. Some of the presentations are related to us, but DCF covers a myriad of issues. And then real quick before we move on to open discussion, I wanted to ask Alan, would you mind just giving a little bit information because Advocacy Days would be next on Advocacy Days?
Yeah, well, this is Alan. First of all, I did have a meeting with all our CEOs today, and I told them if families reach out to you and want to do one of these events that we did in Venice, Florida, that take it on, help them do it anyway, let them use your space. So if you do one in an area that has an ARC chapter, we'll help you have a spot for it. So just want you to know that. And, you know, Advocacy Days is coming up. If you go on our website, it has the agenda. We have to close down how many people we can take next week. We've met the requirement of Disney already, but we're gonna close it down. So we're in good shape. And the T-shirt contest was really fun with self-advocates, and self-advocates picture is going to be on the picture, the program, and all that. So that'll be good. Great art. I had to let someone else choose it because they all seemed good. They all seemed great. But it's coming up soon. It's going to be a blast.
Thanks, Alan. So we all stayed on time, and we have about 20 minutes to open up for any open discussion. If you all have events, if you have reports on legislative matters in your area or questions, like, this is a safe place. We're all just regular people. So if you have any sort of, any topic you want to bring up for the next 20 minutes, raise your hand and we will go in order of what I see. So the first hand I have, going nuts. First hand I see is Tom Nurse. Tom Nurse, you want to unmute yourself?
Yeah, Stephanie, what I wanted to do is if you could take a minute to talk about the online application process work that you're doing and where we're at.
Okay. So this year we had a part of Senate Bill 1758 was for the Agency of Persons with Disabilities to create the application available online. And this is just, I thought that ask was, not as important as I've realized as I've met so many families now that are categorically denied for not having the right paperwork or the right forms. And really excited that the funding is there, the law is passed, and now it's time to do implementation. So I worked on a design based on what DCF's new design is with their application to get SNAP benefits. And I'm going to be meeting. I have a meeting with Director Hatch and the Director of Communications the 16th. So I think that's next week or the following week. To talk it over and to see how we can get it implemented, and teamwork. And my goodness, 2.5 years ago, if you would have said one day soon you're going to be doing teamwork with the Agency of Persons with Disabilities, I wouldn't have believed it. And that is kind of the magic in this, is that's not just legislators. We want the agencies that serve us, the providers that serve us, for us all to work together so we can help them help us.
Yeah, I was just going to add that the opportunity that lies is that there is now legislation that's passed. There's an opportunity to address an issue that's been a barrier. And, most systems are scared of change. So one of the things that is important that we do is put a face on it, put an opportunity on it, offer solutions, and offer leadership. And by doing that, we do need to create the urgency that this is not a one day we'll have an online application, but we want it yesterday. But we want to be part of the solution. And so I think that's really important as we look at the legislative accomplishments in paper from last year. How do we help make them become realized, implemented changes and improvements? And there's a perfect example, the online application. And the opportunity when the opportunity at the Family Cafe presented itself, you were ready. And so it is kind of the harder you work, the luckier you get.
Yeah, and that was, I forgot about that. When we were at Family Cafe, we had a family, I think she's on the line or was on the line, that needed to fill out the application. And so I went over to the APD table and said, hey, I need an application. And that led to the conversation. And I just so happened to be talking to the communications director with the APD, which is the person to talk to about the online application. And so those opportunities, especially this year at Family Cafe, were incredible. One of the other connections made, because we had one, he's like a nephew to me. He had an episode there at Family Cafe, and it created a really meaningful, deep connection with Austin Knoll with ACA. And he is the Deputy Secretary of ACA. And really has a huge heart and connection to our people. And so I think making those meaningful relationships, even within the agencies that service, is gravy. That's like icing on top of the cake. Now we can all work together with one voice. So that's the online application bit that I've got going on. What's going on in Yasmina's world?
Hi, that's me.
Hey.
Well, if you're gonna meet Director Hatch, I really appreciate about the online stuff. I was actually spoken to really rudely by somebody at APD. I'm pretty new to APD. I believe I met you at the cafe. I have a terminally ill child who's 11 years old, and it took me 2.5 years to get her approved for a crisis. I finally got on it, and this is my first time going through all this, and there was a problem with an Excel spreadsheet for the purchasing plan. And I kindly emailed somebody in APD like, hey, for some reason the coordinator keeps kicking it back because it won't save properly. And the guy told me, I am not the secretary for every person on this program. I'm like, this is the first time I ever contact you, and it was just a simple question on who made the spreadsheet. So like, they should have an online system in 2024. And my heart breaks because I'm pretty self-sufficient. But what happens to the older families that have older kids on here that can barely use a computer? Like, why am I constantly being disrespected for no reason at all? Like the email was like, if I put that online, like how I was spoken to for no reason, it's unbelievable. I am trying to do some advocacy work because not only does my child have a developmental disability, she's also a child and she's got maybe 3 years left of her life. There is nothing to prioritize dying children. Like, not only are they disabled, developmentally disabled, but they're not taken into consideration at all. They're lumped into these 8-year, 10-year wait lists. And it doesn't matter. A lot of them just pass before they even qualify. So that's something I'm bringing to the table. Then there's ACA. They did pass a law called the HB 391 bill, so that families that maybe can't get on the wait, that aren't on the wait list, you can take up to 40 to 56 hours of your child's nursing care and be paid in lieu of the nursing care. That bill was passed last year and it's still not in effect. ACA is stalling at every single turn. So there are parents waiting and waiting and waiting for this to come to fruition, especially single mothers like me that could use those hours because nursing agencies can't staff our children. So that's a couple of things. So thank you for this group. I'm new here, and if I can help out in any way, I will. I do have a group that has about 1,000 people in it that are all dying for this law to come into effect. It's called Parent Caregivers of Florida only, and we put pressure on. I did meet with Representative Adam Anderson of Pinellas County. We kind of have a personal bond because his son passed away of the same disease that my daughter is going to pass away from. So he is also on that bill. He also was able to get over $1 million out of Ron DeSantis for Florida State University to open up a genetics department for rare diseases. I was up in Tallahassee on Rare Disease Day. So if I can be of help in any way, and I also really think that children or anybody with a terminal disease, not that they matter more than anybody else, but their time on this earth is so limited, and to have to be put into these wait lists where they don't even have time. You got a child that maybe has a year to live and has to wait 6 months to get that wheelchair they need is ridiculous. I mean, I'm still waiting for her stander. I mean, as she's losing her life, it's there's got to be something that we can do. And like, so Adam Anderson of Pinellas County, I know, is very personally affected by everything. I'm in Pasco, so, but I know I'm not in his district, but he is very, into helping on the state level, and just doing whatever I can do. And thank you for listening to me.
Yeah, Yasmina, this is Tom, and I just wanted to thank you for your courage and your openness and your honesty, and you're right. The urgency needs to be there. And so we need to help change the culture to one of APD cares. That the ACA cares. And in order to do that, the human stories, the human faces, the impassioned truthfulness of your reality can serve as an inspiration and a catalyst. So we love to partner with your group because, there's such a history of thinking, well, families are making money off of their kids, as opposed to these are highly specialized special care needs providers in a system that doesn't have the capacity, and you should be honored and recognized and never treated
Honestly,
as a
you're
mooch.
so right on. None of us, I've never done a GoFundMe. I've never looked for a penny from anybody. All I care about is giving my daughter the services she's entitled to. And no mother or father should ever have to have a GoFundMe because our state can't meet our needs. We got money for wars. We got money to help our kids. I shouldn't have to make a GoFundMe. I shouldn't have to ask people for money. I should be able to give my child a dignified life without putting my hand out. I mean, if you got nursing agencies that can't give me staff so that I could work a full-time job, why? If you're going to pay me less than a nurse and I'm willing to take it, then start it. There's no reason for this delay for a year so that I could feed my family and take care of my child and spend some time with her before she passes. I mean, it's just a stressful situation, and I'm not alone. There are people in worse situations than I am. Like, I'm grateful to have the mother that I have. There are mothers out there or fathers out there that don't have a village, don't have help, and it's not fair when this funding is available. These laws were made, and we should not have to be waiting for anything. And APD is failing the people too. There's no reason I should have had to fight for 2.5 years for something I was entitled to from day one. It's just
we've got to get back to that, inspiring the heart to help. And I think that is a fantastic theme, is that when you can inspire and enlighten and engage people, we can change these systems. And we're so grateful that you joined us, and
thank you. And I'll help any way I can. Anybody can reach out to me. My name here is the same name on social media. So anybody needs anything, I've gone through the process now. I, know what I'm doing. I'm reaching out to legislative members. I, do what I can do. I drove my daughter 4 hours to Tallahassee so that they could see with their eyes, like, this is the person you need to be fighting for. And I'll just do what I gotta do. And thank you. It was so nice to meet you all.
Thank you so much. Do you say Yesenia? Is that what you always say?
Yasmina. It's
Yasmina.
basically Arabic for Jasmine. Yep.
Thank you.
Yasmina.
I don't see any other hands. Does anybody want to just raise an actual hand? I see Lily. Hey, Lily, we haven't seen you in a minute. I'm asking you to unmute.
Hi, guys. Yeah, you just unmuted me. Thank you. Hi, guys. Hi, Yasmina. Very nice to meet you, and I'm very sorry to hear that you're in that predicament. I just put my number on the chat there for you. I am working with a senator on exactly the issues that you're talking about. So I will make sure that you get what you need. Okay? Not with a legislator, not with anyone.
Awesome. Yeah, it's the HB 391 bill, and that bill, I mean, is going to help so much, and it's even going to help APD because that bill is going to give parents that have nursing care, if you already have nursing care, you can be paid, and I think the pay is going to be around $18 an hour. So the state is also saving money because the nurses make between $25 to $30 an hour. So the parent is going to take up 40 to 56 hours a week at $18 an hour. So ACA's saving money, the state's saving money, they're paying us, and at least we could put some food on our tables, and spend the time with our children. So the problem is this bill was passed a year ago. It's still not in effect, and ACA keeps stalling, and that's what we're going through.
But you shouldn't be going through what you're going through. I mean, I have services. I don't understand why you don't have them. So just call me. Trust me on this.
I will.
I
Thank
will
you.
make sure that you get those services.
Was
Thank
that
you.
the bill filed by Trenton? I think his last
Yes.
name, Tremont?
Yes.
Tremont?
Yes, Tremont.
It was
Yeah.
Fremont.
It was the bill by him, and Adam Anderson helped sponsor it. I believe there was a bunch of sponsors. Yes, that was the bill he passed. And with ACA just had a meeting last week on the 31st, and they're still, the nursing agencies already have the training waiting to hire on the parents, and they still haven't been able to do it yet, and just sitting there.
I know that there was a conference, it's like HACOA, that happened in Orlando yesterday. And
Okay.
one of the presenters was ACA on HB 391 rules.
Okay.
So I wasn't there, but those are, the rules process is a whole other part of this that I'm just learning
Yeah,
as
because
it goes.
initially the bill was written that it was $25 an hour for 40 hours a week. Then they turned around and said, no, the agencies are going to get a 25, and then they're going to pay the parents at their discretion. So I'm pretty sure we're looking at like $18 an hour. Then they turned around and said, well, the parents are going to lose their Medicaid after they start getting paid, because now you're going to have income. So now this is a whole new problem. They don't know how to figure out how to create a waiver to prevent the parents from losing Medicaid. So if your child doesn't already have like the Medicaid waiver, this money starts coming in, families are going to be subjected to losing their Medicaid. So now they don't know how to fix the verbiage to either create a separate waiver for this bill so that this is counted as in-home support, so that we're not losing our Medicaid. Like, there is a whole disaster they created, and it's over a year and they still haven't figured it out.
And the Agency for Persons with Disabilities and Consumer Directed Care has been doing this for years.
That's what I said. Why didn't they just follow?
So they could just model that same model and just.
That's what I said from the beginning. We've been saying that. Why didn't you work with APD on this, or model what APD is doing and create a separate waiver for the children so that we don't have to lose Medicaid? Because now
you
they're
have to find the heart to help instead of the process is deny, delay, and discourage. And until we can change the culture, we end up with this.
Yep. And this is what's happening. And there is so many families that are suffering because they can't get the nursing care that they need. People are losing their jobs. Now, a lot of parents, when you have rare diseases, one person has to give up their job to take care of the child. Then single family homes have no choice, So it's a disaster all around. And this should have been done for the people a long time ago, let alone the fact that this is cost saving to the state, because they don't have to pay a nurse $30 an hour. You're going to pay a parent $18 an hour. They're still lining a nursing agency with their income too.
Well, right now they're paying zero.
Yeah, exactly. And that money's just sitting there somewhere.
Yes, Mina. The $29 that you're talking about that they pay the nurses.
Yeah,
the $29.
Oh yeah, for the nurse.
That is the reason that they don't have enough nurses, while other places pay nurses $70 to $80 or $65. Why would a nurse want to take a job that has so much work for so little money?
And now
that's in the lawsuit, actually. But have you tried Crisis?
It took me 2.5 years to finally get on Crisis with APD, but this law is separate, and I was hoping for this law, but I finally just got on to APD mid-waiver 3 months ago. So, but this law is still, I still have to advocate. I created that group for those families. I can't leave them just because I finally got the waiver, and I'm still entitled to that service too, so because, you're still entitled to Medicaid. So, I'm going to keep fighting. This bill should be, in effect, and ACA shouldn't be stalling this long. And even if they have these problems, they can still go ahead and implement the law and fix their problems on the back end. You know what I mean?
Yes. Yeah, we don't leave anybody behind, no matter if it affects me or not. That's
Exactly.
my motto.
That's how I am. And I started this with these people. I'm not going to stop. There's so
Yeah,
many,
I have another group too.
you know,
I'll-
so
All right. Well,
thank you. Thank you for your time.
oh,
Yeah,
I'm
Mina, so
glad
you
that
have
you're
my
here.
number. I just want to tell her, so I gave you my number. Do you see it?
I'm looking for it now. Let me see. It should be in
Because that
the messages.
disrespect that you're talking about is something I'm also addressing.
Good. Lily, I don't see it. Can you send it again?
Yes.
Direct message you. Lily Mebo. Okay,
Lily
here.
Miko.
Awesome. This is a great connection and a good example of how we can discuss what's going on in our lives, and we'll find out that families all across the state may have things at or different connections that we can all put it together and one big positive impact.
And
So we have hit the
Stephanie,
bottom.
Stephanie, real quickly, you mentioned someone who met with, who called Linda and Michael Gottlieb, right?
Yeah.
Bernie, about Ari. Okay, I'll give him a call. I've met with him a couple times. He has a niece who has autism. Actually, he's very nice. And so is Linda. I'll see if I can do anything on my end also to push. You know me.
Yes, we do. And
Push.
you are my favorite. We call you like Aminal from not
I just
Animal.
I just want to make sure it gets done, and and there should be no reason.
You get it
No
done.
reason. Yeah, Michael Gottlieb. Yeah, yeah.
So
But
thank you all for spending your Friday afternoon with us to discuss a really, really important mission that we've got. I want to make sure that we do meet every other Friday. So our next meeting is going to be the 23rd of August at 3 o'clock. And if you haven't put your email in the chat, please do. We're going to send out a sign-up form so that if you have topics, events coming up, ways to enhance our efforts, we can have everyone sign up and we can all take part in our meetings. And we're 2 minutes over, but I'm gonna do it anyway. I do want to share a news story that I read yesterday. There was a 17-year-old child with autism that was sentenced to 5 years for having an aggressive, violent episode with his assistant. And when I read the description of this boy, it was just like my kids. It could easily be my worst nightmare as a parent. And it just spoke so many volumes of what was the actions that took place with this young man and the things that they didn't say to highlight how complex our need. It's just there's so much going on that needs to be improved for the long-term gains and immediate needs of our individuals with developmental disabilities. It was a force multiplier motivator for me to say, we really gotta keep our game up, keep meeting with our legislators. I want to encourage any of you that have any questions. There is no wrong in this group. We are just people trying to make things better, and together with one voice, we will make a difference. And that's it. We're gonna close out today.
Stephanie, this is why we need cops that are trained or trained. I don't even know if I want to call them cops. That's what that's what I think should happen, because this kid, this child, because he is a child, is not a typical child. So they don't know how to deal. Just like, Melissa was saying about some legislators don't know about us and we need to educate them. The same applies. He shouldn't be treated as a typical, other child, because he's not. So when they don't understand, I mean, for someone like that to get 6 years or something, that just pisses me off.
Well, one of the things, and then we're gonna go. Everybody's got to get off the call. But one of the things I did that I just didn't even think about was read the comments on this news story, and it was a very leveling and honest outside opinion of what people really do think about our population. And for just the education to the general public. We have so many barriers to overcome, opportunities to achieve. And I think that what we're doing here by sharing our stories with one another, with our legislators, by connecting and making it personal, will also demystify people's thoughts on our population. So it's
And I'm going to the
heavy
federal
lead
level.
here. It's a
That's what I've
heavy
been
lead.
doing. I'm going to the federal level, and this is a subject that we all need to be bringing up to when something happens to one of our kids like that, because like I said, it could happen to any one of our kids. So,
Lily. So with that, we're going to say goodbye. We're going to do this again August 23rd. Thank you guys for coming.
hi, everybody.